Hello everyone. Today we are going to be continuing about our discussion of ECG. So this will be the second video of the ECG series. So now we are going to be seeing about the definition of terms, definition of some terms that you may be encountering throughout the study of your ECG. So we have the P wave. The P wave is signifying the contraction, or to say the depolarization of the two atria, as we have said already. And the Qrs complex, it is representing the contraction or depolarization of the ventricles, the two ventricles. So we have the J point. So when we say the P wave, as we have already know, the P wave is supposed to be less than or equal to 0.08 second. The ECG pencil has to be covering the P wave in less than or equal to 0.08 seconds. So that means if it is covering the P wave in less than 0.08 second, so that means this P wave is shorter. So that's a pathology. If it is covering the the P wave in greater than 0.08 seconds, so that means the P wave now is wider. So we don't like that because it is pathology. So now we are going to be looking about the Qrs complex. The Qrs complex, it starts from here. This is the Q wave, you see in red. And as we have already know that not all the lead you can find the Qrs, the Q. In some lead, you cannot see the Q, depending on from which side the lead is looking at the heart. If the lead is looking from the to the heart in some particular or certain point, the lead cannot see Q, so it cannot record Q, and it is normal. But some lead can record Q. We will see in the subsequent video how and why the lead can record. Some lead have Q and some don't have Q. So that's it. So the Qrs complex, it is from here to here. This is the Q. So and this Q, as we have already known, this is the right bundle branch. This is the left bundle branch. So this Q actually is referring to the depolarization of the septum. As we have already known, the septum is not depolarized from top to bottom, but it is depolarized from left to right, in this direction. So producing this Q wave, and then as the signal is traveling downward to this side, downward, then it is producing this R wave. So it's producing this R wave up. Then if it is traveling from downward, then it moves upward, then producing this S wave also. So that's it. So I want you to know that the Qrs complex is the polarization of the ventricle. So we have this J point. J point is where the S wave is attached to the ST segment. This is the ST segment. From the end of the Qrs complex to the beginning of T wave, this is called the ST segment. So this ST segment has a very, very important clinical significance. So this is also the T wave. So we have PR interval. The PR interval is very, very important. So the PR interval is 120 to 200 milliseconds. This is the range. If it is less than 120 milliseconds, it is problem. If it is greater than 200 milliseconds, it is also a problem. It has to be within this range. If you convert this millisecond to second, it is 0.12 seconds, then to 0.2 seconds. So that's it. This is the PR interval. So what is the definition of the PR interval? It is defined as the point from the beginning of the P, P wave, up to the beginning of the Qrs complex. That is from the beginning of P wave to the beginning of Qrs complex. That is to this. It's supposed to be PQ, but it is PR anyway. So that's it. So now we are going to see the QT segment, and then the QT segment is from the beginning of this Qrs complex up to the beginning of this T wave. So that's it. So this is the QT segment. So that's it. Now we are going to see the amplitude. The better way to understand what amplitude is when we draw a graph like this. This is a graph. This is X and this is y. When you are traveling in this direction, you are traveling in x direction. When you are traveling in this direction, you are traveling in y direction. So any distance from here to here, from down to up, you are covering an amplitude, and it is recorded in millivolt, that is in voltage. And each small box is representing 0.1 millivolt. So we will see in the subsequent videos, we will see the importance of this millivolt. So that's it. So we have deflection. When we say deflection, the deflection is dependent on the direction of the action potential, or that is the way it's traveling. Different lead has different way of their deflection. Some lead may share the same, but depending on from which side the lead is looking at the heart. Some lead are looking at the heart from the top, some lead from the bottom, some lead from the side, so their deflection will going to be a bit deeper. So that's it. We have the positive deflection. When we say positive deflection, we mean there is upward is positive deflection, and downward like this is negative deflection. So how and why the positive deflection and negative deflection are formed is, any lead, when the action potential is traveling toward a particular lead, for example, this is lead 1, for example, and the direction of action potential is going toward that particular lead 1, that lead 1 will going to show a positive deflection. But if to say we have another lead here, for example, let's say lead 3, and by the time this action potential is going, or the polarization wave is going toward this L, that's toward this lead 1, at the same time is going away from this lead 3. So this lead 3 will definitely show a negative deflection. Another example, if to say we have lead A in this right hand side, we have lead B in this left hand side, and the current is flowing, that is the polarization wave is flowing from B to A. It is at the same time, it is leaving B to A, and at the same time is going toward the A. So A will have positive deflection, like this, positive deflection, and then B will show a negative deflection because the current is going away from the B. So that's how this deflection is all about. So we have R to R interval, and this R to R interval is very, very important because we are going to see the importance of it when using ECG to know the heart rate. There is a way of calculating heart rate through the ECG without touching the patient. So now, if we, for example, we have this Qrs complex, this is another Qrs complex like this. So this is R, and this is R. From here to here, from two different R, the distance is called R to R interval. And this R to R interval can vary depending on the heart rate. If the heart rate is moving too fast, for example 150 beat per minute, you will see the R interval close to each other. You will see another Qrs complex close to each other. But if it is the heart rate is very, very slow, for example 60 beat per minute or 40 beat per minute, you will see from one R to another R, you will see covering a whole distance, a large distance, for example, covering a large boxes between them. So we will see in a minute, or in the next video. So now we have a last question. This is why the amplitude of Qrs complex is greater than that of the P wave. So before we move to that question, we have to explain the T wave. T wave is the repolarization of that is the relaxation of the Qrs complex. And someone will also ask why the P wave didn't have its repolarization. We only have the repolarization of this Qrs complex because the repolarization of P wave is hidden inside this Qrs complex, so it is not seen in the ECG. So that's it. So we have U wave. This U wave is rare and is normally seen, but very, very little. You have to look very, very careful before you see the U wave. So it is insignificant. We don't know how and why the U wave is formed, but If the UF is formed very prominent, so that is a problem, because it is signifying mostly hypokalemia, that is decreased potassium in the blood, or hyperthyroidism, or hypercalcemia. In all of these problems, there is increase in heart rate of the patient. So we don't know why, but we have to just know that in which condition we will see the prominent UF. So that's it. But normally you can see the UF, but it is not that prominent. So coming back to the question, why the amplitude of Qrs complex is greater than that of the PUF? Because if we look, the ventricles are larger, and then they are thicker. So the most important is because the ventricle are thicker than the atria, than the atria. So that's it. So that's why the amplitude, we see the amplitude of PUF, it is little, but we see the amplitude that is from down to up distance of Qrs complex, because it is very tall. So the amplitude means it is very high. So millivolt is very high. So even if the by any reason, if the atrium will also become very thick, their amplitude will going to increase. For example, like this. So this means the more thicker, the more the amplitude. So that's it. So now we come to the end of this uh, second lecture of Introduction to ECG. So in a nutshell, we are going to recap. This is the PUF, denoting the what? The depolarization of the atrium. This is the Q, depolarization of the septum, and it is moving not from up to down, but it is going from this left bundle branch to right bundle branch. But the contraction of the ventricle itself is going from this up to down, then from up to down, and then again up. So that's it. So it has to have two directions, from up to down, then from down to up, so to complete the whole thickness of the muscle. So this is the J point, connecting them, connecting this S wave with this ST segment. We have this T wave, and then we have the E wave. So that's it. So thank you very much.